Good afternoon, everyone. I'm really glad that you could join us. We have a lot of people joining us today, and in the interest of time, we will go ahead and start up with the introductions and then get into our program while people are still joining us. Um, I'm Dave Engelthaler. I am a board member of the Northern Arizona Leadership Alliance, and I'm also a Flinn-Brown Fellow. We've really brought both of those two groups together today to bring you a great program. Uh, Definitely want to welcome you to this special virtual town hall style discussion on issues surrounding Proposition 480. This is that citizens referendum on whether or not to rezone a portion of land near Fort Tuthill that will allow Northern Arizona Healthcare to build a new hospital in Flagstaff. This event, as I mentioned, is actually co-sponsored by the Northern Arizona Leadership Alliance, or NALA, and the Flinn Foundation CivEx program. We have multiple Flinn-Brown members, and as they introduce themselves, they'll mention that as well too. I need to give a big thanks to Dawn Wallace and her team at Flinn for running the logistics for this Zoom event. I also need to thank the NALA Community Civility Project, which has really worked diligently to bring together a diverse group of leaders that will discuss this proposition and the community healthcare needs that surround it, and do it in an honest and civil manner. So I additionally want to then thank my co-host, the Honorable Dr. Coral Evans, and our moderator, radio host, and Pastor Jeff Kennedy, and of course, all those speakers who really had the courage and the character to come here today to speak with civility and frankness alongside other leaders from this community who might not agree with them. And lastly, I want to thank all of you for attending today, hopefully with an open mind and an honest love for this community. I'm sure you're all as excited as I am to listen and learn from these speakers. And we're going to get started here in a second, but I do have a couple housekeeping items first. We originally only had 60 minutes scheduled for this, but since we added a couple speakers and there's a lot to discuss, we're now able to go into overtime. We're going to actually plan for up to 90 minutes. If you can stay with us, we know that some people will have to break away, but we're adding a little bit extra time in there to hopefully discuss even more items around this. And also, we do have the Q&A feature available on this Zoom, so questions can be submitted, but those questions are only going to be visible to the speakers and to the moderator. We'll attempt to actually try to get to some of these questions after we get through the first part of our discussion, but we'll make sure all the speakers do get the questions so that they can respond to them afterwards if they're able. Okay, in the interest of time, I want to get us moving, and I'm going to now turn it over to my co-host and friend, former Flagstaff Mayor, Dr. Coral Evans.
Well, thank you so much, Dr. Engenthaler. I want to say thank you to the Arizona Civic Leadership Program, Dawn, and everyone else at Flinn-Brown. As a Flinn-Brown Fellow, it is absolutely my joy to be here today with other Flinn-Brown Fellows to have this conversation. I want to say thank you to everybody who's joining us for this conversation, not just the people that are on the screen, but the individuals that are out there listening and participating, actively listening and participating, as well as thank you to Pastor Jeff Kennedy for agreeing to facilitate this conversation. As many of you know, my family has been in Northern Arizona for a total of 6 generations. And I've been watching this particular discussion on various social media platforms. And I know for a fact that today's conversation will not reflect the incivility that is being seen in those particular spaces. We live in a beautifully diverse community and region, and diverse not only in our environment, but also in our people, our thoughts, and our ideas. And collectively, we act as stewards for this place that we all call home. We will not, or we don't always agree on everything, and that is clearly understood because we're so diverse. But what is very important is that we disagree in a manner that allows for us to speak after our disagreement and allows for us to come together around these things that we truly love, such as our community and the environment in which we live. Ever focused, all of us, on the collective stewardship of this community. And so with that, I'd like to go ahead and turn this over to our facilitator, Pastor Kennedy, who is going to lead us in this community conversation.
Thank you, Dr. Evans. Thank you, Dr. Engelthaler. It's a privilege and an honor to be here and have this opportunity to facilitate this conversation. You know, I want to just remind everyone that it's not our objective today to necessarily promote a specific viewpoint, but we do want to provide a platform for diverse voices and perspectives to be heard. So we aim to foster, I'm going to say, a constructive conversation that empowers you to make informed decisions. So hopefully we'll be able to do that. Hopefully we will demonstrate that we can have civic discourse and come away with it and still call each other friends, colleagues, and members of the same community. And we all want the best for Flagstaff. We may just come at it from different angles. So our panelists today are all individuals who bring a wealth of knowledge, experience, and expertise to the table, and they represent these various viewpoints. And they've graciously agreed to share their insights with us, and I'm anticipating a lively but respectful conversation. So with that, I want to introduce our panelists, and I'm going to introduce them in the order that they're going to speak. Each panelist is going to have roughly 5 minutes opening comments, and then we'll start directing questions from there. So the first one to go will be Gail Jackson. She is the president and CEO of Economic Collaborative of Northern Arizona, or ECONA. Mike Martinell will go second. He's a former NAH board member. Daryl Melvin, president of Melvin Consulting, a current NAH board member. Kim Musselman will go fourth, the director of Coconino County Health and Human Services. And the Honorable Al White, former vice mayor of Flagstaff. You get to go last, my friend. So with that, I just want to remind you before we dive into this that it is important that we maintain a respectful and civil tone throughout this event. And again, our goal is to foster an atmosphere where all voices are heard and respected regardless of our stance on the matter. So we've all agreed to these conditions before coming on. So with that, Gail, I'm going to turn it over to you. Gail Jackson, President and CEO, Economic Collaborative of Northern Arizona.
Thank you, Pastor Jeff. It's a pleasure to be here. I am a Flinn-Brown Fellow 2023, and I just want to give special thanks to the Flinn Foundation for hosting this today. Today I'm going to be speaking. I'm not advocating to vote yes or no. Just want to provide some data. For those of you that might be on the call and not familiar, ECONA is the premier regional economic development organization in Northern Arizona. We are supported by a multitude of agencies, and we work collaboratively with our partners to improve economic vitality in Northern Arizona. So I'm going to talk about a few ways that this medical expansion supports positive economic development. Number one is obvious, jobs. That's what we do in economic development. NAH is a major employer in our region. They provide hundreds of high-paying jobs to the residents of Northern Arizona. And healthcare and social services are the number one industry in Flagstaff. This sector provides over 9,000 jobs here. Number two is quality of life. This project is innovating the way healthcare is being performed. They recognize, NAH is recognizing a proactive approach to healthcare rather than reactive, meaning you get sick, you go to the doctor. This is a health and wellness village that's being proposed. Obviously, this Prop 480 is just for phase one, just the hospital portion of this project. They are incorporating the wellness portion of the village with the main hospital facility, and I believe that this is the way that healthcare is moving when we study it. Number three, it gives back to the community. This addition of new space for Flagstaff specifically provides opportunity for future employers and current employers who may be considering an expansion or a relocation. This is something that doesn't exist a lot here in Flagstaff because the infrastructure is simply, it's not available. Number four is recruitment. There's a worldwide shortage of medical professionals. So when we talk about staffing issues, This is not something that is specific to Flagstaff Medical Center. This is happening all over the world. In fact, Arizona is number 5 in the US for shortage of medical staff. So a modernized healthcare system will not only help hospitals attract physicians, nurses, and staff, it allows employees the space that's needed to carry out their jobs efficiently. It also allows businesses to be able to stay here and grow here because they know that the medical system is not antiquated and that their employees and families are going to receive the best possible health care that's out there. When there's a thriving hospital system in a region and healthy employment levels, the demand for schools, housing, transportation, and all other services increase. If a company is looking where to expand, the first thing that they ask us about is our school system and healthcare systems. They want to have the ability to attract and retain their own employees, regardless of whatever sector they're in. This regional hospital expansion is not only important for residents, but also to the 6 million visitors that travel through our region annually. I wanted to touch a little bit on too, how our region has been preparing for this. For those of you who aren't familiar, 80% of the new jobs that are created come from an existing business and investments. It's not from bringing somebody in new. Nationally, the Biden-Harris administration has committed to making sure that rural Arizona is taken care of when it comes to healthcare. USDA has awarded over $129 million in emergency rural healthcare grants. This is huge. Our state leadership, Governor Hobbs, has allocated millions of dollars in her budget to protect the health of all Arizonans, nearly $3 million for the Medicaid enterprise and $10 million for Arizona State hospital staffing shortfalls. Locally, NAU recently announced an expansion of its own healthcare programs with the addition of a medical school and the College of Nursing. CCC, Community College, has expanded several scholarship programs and increased enrollment in its nursing programs. APS, which is our local power provider, they, back in 2015, had the foresight for this area where this proposed hospital is going to add a substation called the Soldiers Trail so that they would be able to serve this area in the future, knowing that the need would be there. And then, of course, the city of Flagstaff will see tax revenues as well as the county will also see property tax revenues as well. So I will leave that at there. I've got a lot more to talk about, but I'm going to pass it on. So thank you for that. Talk to you soon.
Very much, Gail. I really appreciate it. And you didn't quite use your full 5 minutes. We're going to pass things over to Mike Martinell, former NAH board member. I know you spent 27 years with Gore and Associates in finance, and you are now on the clock.
Thank you. Good afternoon, everyone, and thanks for joining this webinar. A special thanks to our organizers and moderator for putting this program together. As you just heard, my name is Mike Martinell. I'm a 30-plus year resident of Flagstaff, a retired Gore associate, and most recently was a member of the board of directors at Northern Arizona Healthcare. I served from September 2019 to May of this year, almost 4 years. It's just a rezoning ordinance. That's what they're telling us. That's what Northern Arizona Healthcare and the Flagstaff City Council wants us to believe. But Prop 480 is about letting a private corporation decide what the future of Flagstaff is going to look like for the next 50 years. And to get us there, NAH has a playbook of reasons why we should support their plans to move the hospital and build out almost 200 acres of forest land for commercial retail, hotels, housing, as well as the hospital and a medical office building. NAH wants us to believe we need a new hospital because they're turning away thousands of patients every year. Personally, I don't know if it's thousands of patients, but I do acknowledge patients are seeking healthcare elsewhere. In a recent Daily Sun article, Dave Cheney, the current CEO of NAH, stated, and I quote, "Every year, thousands of patients must fly or drive to another city, usually Phoenix, Las Vegas, or Albuquerque, because we simply don't have the capacity at FMC." Yet NAH's own reports filed with the state of Arizona show that their capacity rates, which measures inpatient bed utilization, for the last three years has been between 56 and 68%. Inpatient surgeries has not grown over that same period of time, another indication that NIH is not filling beds. In other words, NIH is not full. NIH says they can't utilize all the beds because of the shortage of healthcare workers. They've been managing what we call ratios, which is the nurse to patient ratio, which is a good thing if you want to maintain high quality care. But this begs the question, why do we keep hearing about unhappy providers leaving NIH? And this is not recent activity. Let's look at some data. NIH has an employee turnover rate that exceeds the national average. But why is that? Flagstaff's an ideal location to raise a family and enjoy the outdoors. It's because healthcare workers are underpaid by NIH. They can't buy a home, provide for their families, and build loyalty to the system. They are overworked and treated poorly. And my Zoom just went off. There it is. Why would they stay? At the end of the day, people are leaving Flagstaff for care, but many are choosing to seek care elsewhere because they can't see the provider they need when they need care, or there aren't enough providers to safely administer care, or the specialty they seek just doesn't exist in Flagstaff. A new hospital and medical office building will not fix any of these issues. Unless there is a fundamental shift in attracting and retaining providers by the leadership at NIH, this problem known as access to providers will plague the system well into the future. We are not out of room at FMC, and for the region to get the most out of any facility upgrade, we need to be able to keep our providers. NIH says they can't build at their current site. They claim a study was done that said it wasn't feasible to renovate in place. But what about the New Era strategic plan developed in 2018 by NIH leaders and its providers, which was recently made public and is still advertised on the NIH website? A couple of weeks ago at the NIH Q&A session at the Murdoch Center, NIH denied the document even existed. The New Era strategic plan contained a line item to build a new patient tower on the FMC campus. In fact, some of the building projects in the strategic plan have already been completed, like the hybrid operating room and upgrades to their central plant. Renovation in place is possible. NIH has proven it. And by the way, converting to all private rooms was part of that strategic plan. NIH has significant land holdings and healthcare facilities directly on the FMC campus or adjacent that could be developed. The Summit Center, purchased by NIH several years ago, sits within a few blocks of the main campus and could be a perfect spot for an outpatient surgery center or offices for providers.
And Mike, your initial 5 minutes are up. I'm going to give you about 10 to 15 more seconds to wrap up.
Okay, that's fine. I guess in summary, I won't read the rest of what I've written. For these and many reasons that Flagstaff Community First, as well as myself, are opposed to Proposition 480 and the information that's been put out there in the community. Thanks.
Thank you very much. Really appreciate it. Our next panelist, Daryl Melvin, president of Melvin Consulting, a current NIH board member. You are on the clock, my friend.
Thank you, Pastor Kennedy, and it's a pleasure to be here with all of you, and I welcome this conversation. As mentioned, my name is Daryl Melvin. I'm a principal at Melvin Consulting. We are a Hopi-owned and founded firm, and I'm also a current board member with NIH. I've been with the board a little over a year, so relatively new to the board. And so today I want to share my perspective in support of the new hospital. And it's not because I'm a member of the NIH board, but it's from the perspective of being Hopi and Navajo and a resident of Coconino County. And because I live in the county, like others of you who are served by Flagstaff Medical Center, I cannot vote in this citywide election and have a voice on an issue that I believe impacts Northern Arizona's wellness for generations to come. Native people are diverse, yet we have one value that we hold in common is maintaining strong relationships. We call this being a good relative, and in Hopi we say Samit Nomo. This means that we base our decisions making on the best interests of our community, elders, our youth. Being a good relative is the fabric of what binds our community and our people together. So like many of you, I've had significant events occur at Flagstaff Medical Center, leading to the interaction I've had with the outstanding staff. My granddaughter was born there in 2017, and a few years ago, my mom fell, causing a head injury, requiring surgery and inpatient stay. And it's from these experiences that I observed that the inpatient rooms were small, needed more space for the medical equipment, and the staff found it working in these cramped spaces challenging. And despite the ongoing improvements, the facilities remain inadequate today. Also, as the past CEO of the Hopi Healthcare Center, a critical access hospital, I also want to share with you that in our work, we treated more than just Hopi and Navajo patients, but visitors from across Northern Arizona and worldwide. Whether a patient came to the ER due to a sports injury or chest pains or an accident, our dedicated team treated these patients like our relatives, providing urgently needed care. And if necessary, we provided the transportation to FMC, which is the only level 1 trauma center serving Northern Arizona. And it's considering these reasons that I asked the citizens of Flagstaff to be a good relative for those who do not have a voice in voting, but have a compelling interest in a better healthcare for all of Northern Arizona, because being a good relative is a value that we all share. Thank you.
Thank you very much, Daryl. Really appreciate those comments, and we will certainly circle back around to you. All right, Kim Musselman, Director of Coconino County Health and Human Services, you're on the clock.
Hi, thank you again for having me, for all of those that put on this event. And I'm honored to be able to participate in such an important discussion. As the Director of Coconino County Health and Human Services, and in my role as Chief Health Officer for Coconino County, I'm acutely aware of the need for a robust healthcare system. My comments today are going to be representative of the needs of our entire county of Coconino, not only the Flagstaff area. As I share my few minutes of information, I want to start with an acknowledgement of a sign that I was given by a close friend a few years ago, and it sits over on top of one of my shelves in my office, and it says, "Hard things are hard." And I look at that often. I've looked at it often over the course of the last 3 years in particular. And I say that because just because hard things are hard, it doesn't mean that we don't charge forward and we peel back the layers. We reach out to our communities, we listen to concerns, and we work through the challenges in an honest and transparent way until we reach a viable solution that will be in the best interest of our entire county and region. And at least for the purposes of this discussion, I will be referring to the region. The public health system has many components, of which HHS is just one component in that. Our partners obviously include our community clinics here in Flagstaff, as well as across the county, our private physicians, our mental health providers, our insurers, that's just to name a few. And our hospitals are a vital part of the healthcare and public health system. In order to thrive, our community must have equitable access to affordable, quality healthcare at all levels. In recent years, the importance of this has been made even more clear. COVID-19 pandemic resulted in a disproportionate loss of life to our communities of color, both within the city of Flagstaff as well as across the entire county. And as we navigated COVID as a community, we had to rely heavily on our partnerships and collaborations between our hospitals and our other public health members of our system. These alliances remain critical for improving the health and well-being of our communities, addressing health disparities across our entire county and region, and addressing the social determinants of health, one of which is specifically equitable access to affordable quality health care. We have several historically underserved communities within Flagstaff and throughout the county, which we must remember when discussing potential impacts of upgrading or not upgrading our hospital system. Every provider has challenges. There's no one perfect solution for any one organization or system that's going to turn everything around and make it perfect. Meeting the growing medical needs of our populations necessitates robust facilities, state-of-the-art technology and equipment, and a strong workforce in order to provide the best direct service and care. Location is just one aspect, and the challenge being discussed with this proposition is the proposed location. The larger challenge is how to address the deficiencies in delivering the needed services. In a county as vast as Coconino, the availability of transportation to and from a regional medical center must be at the forefront of any solution. Transportation is a basic but necessary aspect of ongoing healthcare, especially among our aging populations, those with disabilities, and individuals who suffer from chronic diseases such as diabetes, heart disease, cancer. The list goes on. The importance of state-of-the-art hospitals is highlighted as our population grows, as our environment changes, and as our population ages. The growing elderly population will be a major determining force for the demand and supply of health services, and therefore for the type of resources needed to provide those services. According to the American Community Survey, based on 2022 populations, the city of Flagstaff has 11,778 residents that are older than 60 years of age. In the next 5 years, that population will continue to grow by an additional 19%. Many of us on this call and others listening are either in that category or will be. According to the same survey, Coconino County, so countywide, has 30,072 residents that are older than 60 years of age. In the next 5 years, that population will continue to grow by an additional 21%. So that population and that number will increase by 21%. Hard things are hard. Many factors affect equitable access to affordable quality health care. These factors
Kim, I
include
apologize. You just reached that little over 5 minute mark, about 10 to 15 seconds to wrap up, please.
You got it. I have 2 more sentences. As I was saying, hard things are hard, and many factors affect equitable access to affordable quality health care. But we must do the hard work and implement solutions that will benefit all of our communities across our region. Thank you.
Thank you very much. All right, and finally, the Honorable Al White. You've got 5 minutes, and then we'll start to ask some follow-up questions.
I'm going to echo a sentiment that was expressed by Yogi Berra at one point when he was invited to a meeting. He said, thanks to the people that made this meeting necessary. And so I think that sentiment applies here as well. I'm going to express opinions that are mine based on observations that I've made following the discussions I've seen so far. I am advocating for a no vote on 480. And I think the number one thing that I want to start with is I just don't think people want the hospital to move. We're talking about citizens of Flagstaff, but we're also talking about citizens in the county. People in Doney just saw their hospital essentially move 5 miles further away. People on the other side are saying this will bring congestion and maybe some unwanted growth to our area. I think the original contract holders or people that put this NIH together in the first place are feeling somewhat betrayed based on the fact that that NIH is moving into another field of endeavor versus healthcare, and will healthcare become a secondary concern of theirs versus property development? Remains to be seen. And last but not least, the support of medical businesses that have located close to the medical center based on their auxiliary functions to work together, I think are feeling somewhat betrayed as well. The Taylor House, for example. Now, there's a yes. I thought this was ironic. There's a yes on 380 sign at the Taylor House, but the Taylor House is, of course, NIH property. The Taylor House, and in case people don't know, the function of the Taylor House is to provide a place for families to come and stay when one of their family members is in the hospital for extended stay or very critical care. So the hospital, the rehab hospital of Northern Arizona on McMillan Mesa also is a auxiliary and additional business that I think located where it is to be close to the current medical center. Point number two is I don't think NIH has really made a very convincing case for why they can't do all of the things that both Gail and Kim suggest we need to have for critical health care in our community right where they are. There's plenty of land. The infrastructure is already in place. I believe that the city and particularly the council moved very quickly to expedite the rezoning to move the hospital. My guess is if the hospital had suggested that they wanted to do upgrades in place, that the council would consider things like closing Beaver Street north of the God, what's the name of the? I hate it. Right north of the shopping center there, and also putting in variances that would accommodate anything that basically the hospital said they needed to do to bring a fine and representative of the best quality healthcare right where it is. The vacated property that's going to be left there behind. The development agreement calls for a robust committee to discuss it, but the last line of that says if they can't come to terms, then NIH will be the arbiter of that. I think a no on 480 vote is going to basically get the conversation back to the community, and that's very important in terms of the disposition of this valuable community asset. And last but not least, phase two. And I realize that in many ways the strategy has been to just keep the conversation around phase one, but you can't. They're inextricably linked, and I don't believe that you can do the conversation on the issue without bringing up the rest of that development. And what is that development going to look like, and how does it apply to the regional plan? And I mean, basically, I don't think that the people who are against 480 right now are being the anchor to a huge development on the western edge of town is necessary for fine health care. It's urban sprawl.
We have reached that. We have reached that 5-minute mark, a little bit over 10 seconds.
I knew that was going to happen. Let me just put it to you this way: if I can be of assistance in any form, regardless of how the vote goes, I would love to do that. And if I can delve deeper into any of the things that I'm starting to express here by email with participants in this forum, I would be happy to do just that.
All right, very good. I appreciate everyone's opening comments, and I'm going to start by just throwing out a couple of questions or topics that will be for everyone. You are not under an obligation to answer each and every one of these questions, but if you want to weigh in, just put a hand up or if no one is speaking. We're going to try not to speak over one another. I would ask you to keep your comments in the 1 to 2 minute range so that we can have plenty of opportunity for others to weigh in. One of the key issues that has come up that keeps being asked around this topic is, has NIH made a convincing enough case for not developing where they are on the existing site? I would like to open that up for conversation, because that seems to be one of the first questions or one of the first comments that comes up. Why can't we just build where we are? That's open for anyone.
Okay.
Okay, Gail, I'll start with you.
Hi. So, working with CEOs and businesses all the time, they do everything they can to stay where they are. And I think that we've heard this come up over and over again, that the infrastructure is there. Why don't they just stay there? I think one of the things I would encourage is, if anybody that is here is friends with perhaps an electrician or some sort of person that may have worked on the hospital, I think that's really important, because this building was built 50 years ago, and there's been a lot of buildings that we've had to change in the last 5 years. We have a new courthouse. It was needed. Our schools just passed a new bond because we need new schools based on everything's gone electric and it's not wired properly. So I guess I would just encourage people to look at that from an infrastructure perspective, and ask your neighbors, and perhaps maybe they've had something to work on the hospital. So I'll just leave it at that.
Melvin, you're next up.
Thank you. So first off, I'm going to just clarify a couple of things that were brought up, because I think it's helpful for the audience to really understand what is being asked of them in this proposition. So I believe City Council had already acted on a regional plan request, and that was just to allow the new location for the facility, the new hospital. As a part of that, there's 2 additional zoning requests that are coming up. The one that we have today, which is in 480, and there'll be a future one, which we'll call phase 2 and phase 1. The phase 1 rezoning really is about the hospital. It's about medical offices and an ambulatory center. And so that's the one that we're requesting in Prop 480 to be approved, because I think that's what's most critical and important. Phase 2, which is the business development element, really that rezoning can be talked about at the time that it comes before City Council. And so I want the people out there to understand there's really 2 different rezoning requests. So keep the focus on the hospital rezoning. Why is it important? Is because hospitals are developed on a generational basis, meaning that what we see today being developed is going to be the health system in the greater Northern Arizona community for generations. It takes decades to plan, to design, and to build. And I'm a civil engineer. As part of my work in the public health service, I help design and build healthcare centers. And so it's important to understand that timeline. And why is that important? Because of the reasons I discussed about an old facility today. Imagine in 20 years from now, how is it going to be able to address and accommodate those new technologies and services? And so we're talking about the future of our children and how we receive services in Northern Arizona.
Thank you. Mike Martinelli.
Thank you. To answer the question, has NIH made a significant enough point about not being able to build on site? I think there's still a long ways to go for folks that are opposed to Proposition 480. As I mentioned in my opening statement, there was a plan that was developed in 2018 called the New Era Strategic Plan. I think it was the hospital's first strategic plan. And as a board member, it was the first document I was given to read through. It was the roadmap of what the hospital was going to do for the future and how it was going to meet the needs of the area. And there were several line items in that strategic plan that NIH has already executed on. They've already gotten some of those items completed. A couple of those items I mentioned, the the hybrid OR, which is a brand new state-of-the-art operating room that they use, and have been able to bring breakthrough technologies up to Flagstaff, where before patients were having to go to Phoenix to have those procedures done. And they've done that. They've proven that they can build these things on campus. So as a board member, I don't ever remember seeing this study that they reference. I don't know that NIH has put out into the public domain for consumption by everybody that here's the study that was done. So I think they're a long ways away from being able to prove that they can't renovate in place, like many other hospitals do.
Does anyone else want to weigh in on that before we move on? Okay, very good. And thank you for those comments. And Mike Martinell, I apologize for the mispronunciation. We'll work to get that right from here on out. So let's move on then. So how would a new Northern Arizona Health Village possibly improve access and services for Flagstaff residents?
Really quickly, I don't believe that it would necessarily. I think we're still dealing with the concept that somehow it can't happen we can't get a good hospital where we are now because of antiquated buildings and so forth and so on. I think the current executive director put out an article saying in 1972 hospital is what we have there. I have had personally 8 operations since I broke my back. They've all been done there, and they've been done with the latest technology and very successfully. The implication that they have to move to get a nice hospital, I think, sends the opposite message about what they have there now, and I don't believe that that's the case. I just had cataract surgery. Cataract surgery was done. I don't have 1972 eyes. I have 2023 eyes, and I'm very happy with the work that's been done. I think that they still need to make that case, and so I disagree with the statement that they have to move to be the state of the art. Thanks.
One of the comments, another one of the comments that comes up from people who have been visiting the current facility for a long time is just, outdated facilities and an inability to upgrade to, better technology, better equipment, better access where we are. And I think that that's an important issue because anyone who has spent time in the current hospital or has had, a loved one, a family member there, knows that there are some significant issues with outdated facilities and the like. I think as we think towards, the next, decade, 2 decades, 3 decades, having a facility that offers more state-of-the-art facilities, equipment, and the opportunity to grow more into them just maybe makes sense for this community. Would anybody like to elaborate on that? Mike, we'll start with you.
Thank you. It's interesting that because we've heard those same comments and same remarks by a number of people in the camp of 480. It's interesting though when you look across healthcare in general, not just in Flagstaff, but look at trends of what's going on in healthcare in general. There are numbers of facilities around the country. In fact, we don't even have to go very far. We can only go as far as Phoenix, where they have taken current facilities and upgraded those facilities. The latest example I have through a conversation I recently had with the CEO of Banner Desert down in Mesa, Arizona. And that is a facility that has parts of it that are 50 years old. I remember because my son was born there and he's 43. So I know that it was around for a few more years than that. But it's a 50-year-old facility. And they just completed an on-site bed tower for women and children. So it is possible for healthcare systems to renovate in place. But if your choice and your view is that you want to build a brand new hospital like the one that has been depicted for us out at Fort Tuthill, and not consider any other options, then I think that's a very narrow approach to trying to solve the problems that NIH has today and what they think they're going to have in the future. And not to make light of this or diminish this, but we've got to have providers that stay there and provide the care. Having bright, new, shiny facilities and you don't have the providers is not going to help the problem.
Daryl, Melvin?
Thank you, Pastor Kennedy. So in the work that I've done and just being familiar with healthcare organizations, I can share with the audience that, you know, when you're looking at developing a new facility and considering all of the requirements for such a new facility, I would look at, say, for example, a biomedical engineer, a biomedical tech. And when I started in healthcare many years ago, decades ago, you might see in an inpatient room probably maybe 2-4 pieces of medical devices per bed. And if you look at the way the trend is going today, we're currently somewhere in the neighborhood of between 12 and 15 medical devices per inpatient bed. And you think again about all of what's required in that room. And if you've had, had to be at the inpatient, you can understand when you have the nurse coming in, trying to move the equipment, the nutritionist coming in to provide a tray for food, and then you have the pharmacist trying to squeeze in to speak with a patient. And then you add that, you're sharing a room with somebody else. So when you talk about the trend in healthcare, it's not so much about just getting the new stuff, but it's maintaining and being current with expectations for healthcare. When we have in rural communities attracting and recruiting medical providers, we call residents. A resident, when they come to a rural community, is more likely to stay in that community if they do their residency there. And so when you're recruiting, we think about what type of training have they had? What are the devices they use as a part of their training? And consequently, what would they like to see in the facilities that they work in? And so these considerations, not just the equipment, but the new generation of providers coming to rural communities, and what are they seeing? And so those are the factors that you also consider when you talk about how can you develop new technology and move equipment into a facility, particularly one that's the age that they currently have at Flagstaff Medical Center, and how can you incorporate that into newer facilities? Thank you.
Thank you. Al?
Thanks. An observation here, I think that that needs to be brought out is the question of what does the medical center need to do to upgrade, and what is it that they want to do with this project. And I don't think that you can separate. I certainly agree with NIH when they say they can't do what they want to do on that site, because part of what they want to do is 315 homes, hotels, restaurants, retail operation, and a village that has 170 something acres versus the 40 acres they have to work with there. I think if they separate the two out, they can still utilize their investment in real estate to help upgrade, but they could certainly upgrade where they are. Thanks.
I want to switch to the question about access. And I think this is very important as we move forward. And again, as we think about the future of Flagstaff, I know that it was mentioned earlier how Flagstaff is getting older, and sometimes access for the elderly can be very difficult. So in the context of the current site or a new site, which will offer the best long-term solution for access for not just residents in Flagstaff, but throughout the entire region and throughout Coconino County? I believe this is an important part of the discussion that we need to have. Kim?
Yep, thank you. I think what I would like to add about this is, at the risk of stating some of the obvious, the proposed location happens to be at the intersection of I-17 and I-40. And when we talk about our region and we talk about all of Coconino County and accessibility and ease of access, for some modes of transportation. You know, one can argue whether or not it moves a hospital, 15 minutes further from Doney Park, it moves it 15 minutes closer for Kachina Village residents, for example. I mean, and that's just a very small Flagstaff area example. And so when you start talking about our tribal entities, our small rural communities that do not have hospitals, that Flagstaff is the closest regional hospital, and especially for a trauma hospital for those services, those are things that have to be factored in that. Of course, the transportation piece is even bigger than that, because it's about how are people able to get there if they are not driving any longer? What are those modes of transportation, whether that's public transportation, other things that allow for folks to be able to access a location. So I just think those are all part of those conversations that are not, there's not a simple answer that can be applied to, and solve all the issues, because we have issues with the current location related to transportation, and we have proposed issues with transportation related to the new proposed location.
Sure do.
Daryl?
Thank you. So, just to start off with, if you're down in Phoenix and you're talking about Flagstaff, Flagstaff is rural. But when you're in Flagstaff and you start talking about going east or west on I-40 or north of Flagstaff, that's rural. And so not just talking about native tribal nations, but also about those county residents. Rural Arizona healthcare is challenging to provide those services in these really rural areas. And so in tribal communities, the focus is on building what I'll call primary care. That just means your family doctor. You can go see your family doctor. And building that capacity in tribal nations, they call it horizontal integration, is important so that you always have somebody that you can see to start your entry into the care system. Beyond that, there's the referrals. Sometimes we have emergent or urgent care needs, and that's at a higher level. And that's when we talk about Flagstaff Medical Center as a level 1 trauma center. And so when we do partnerships with primary care services in a system like Flagstaff Medical Center, we call that vertical integration, because that means you can go from where you would see your family doc to go see that specialist. And that's important because we have to create these partnerships. And so when rural communities out there in tribal nations or in just in the rural county areas build these clinics, Northern Arizona clinics for primary care, they have to partner with somebody like Flag Medical Center. And so when we have a receiving and a referring organizations working in partnership, that's a benefit to both. And that's what the opportunity is when we talk about developing Flagstaff Medical Center as this more technology friendly, more capacity to be that referral center for all of Northern Arizona. Thank you.
Thank you very much for that. Just before we go on to maybe the next set of questions, curious, because there's a lot of people that are on the fence, and depending on what day of the week it is, they're on the yes side or the no side, and really struggling with finding a safe and comfortable place to land that's going to be best for their community and their families long term. Who on this panel has changed their mind? When this was initially proposed, felt one way, and as you've dug into the information, your mind changed. Anyone on this panel?
No, sir.
Al?
No, sir. I've still have maintained that there are a number of things that a renewed community discussion and examination of all of the issues that are part of this amazing growth to the west, and or the ability of the hospital to become a premier site right where it is, still need to be examined. So I think that's the no answer. The no vote is the way to get there versus the yes vote that then puts the project in place, gets it going, and it will be very, very difficult to make changes after that.
Yeah, so let's ask the question this way then. Will the healthcare village contribute to an overall improvement of the quality of healthcare in the city? Nobody wants to touch that one, huh?
Well, Gail does.
Okay, Gail?
I wanted to add that, Al mentioned something that a no vote would keep the hospital on the hill. I think that when you ask, has it dissuaded or persuaded anyone in a different way? I think regardless of whatever side you're on, we can all agree that modernized healthcare is needed.
Absolutely.
Right? Mm-hmm. We can agree to that. And I think that, in working with CEOs, I mean, there's always a backup plan, right? When we're in business, we always have a contingency plan. We're looking for certainty as we move forward, and change is hard. And we're talking about a futuristic project. Mr. Martinell had mentioned the towers going up. That's part of modernized healthcare, is the ability to go up and down quickly. If you're dying of a heart attack, I mean, seconds matter. And so I think architectural design has changed over the last 50 years. And so I'm not advocating one way or the other, but I think that we need to think about that and how we move our community and our region forward. It is accessibility, and it is about modernizing it. Modernization is key. We talk about it at the national level, the state level, and we talk about it here. And so I just wanted to add that little piece.
Thank you, Gail. Daryl?
Yeah, thank you, Pastor Kennedy.
Daryl?
So I would say that when it comes to keeping, again, phase 1 rezoning is Prop 480, and phase 2 comes in after the fact. So I would say the movement for me personally has been that with the announcement that NAU is looking to potentially starting a medical school for primary care providers, with that information, I believe that creating this new hospital, the ambulatory center, as well as the offices, medical offices in phase 1 zoning, which is Prop 480, I believe that moved me more in support of what's occurring, because creates this partnership and opportunity to bring innovation, new medical services, as well as residency programs right here in Flagstaff. That said, when it comes to the phase 2 component, the business development, I personally haven't made up my mind in terms of how to have these conversations. When I look at our current board composition at NAH, 40%, almost half of the board members have been new since about 2021. So there's opportunity to have these conversations about what that would mean and what that would do. And so that's how I would answer your question about, we need the hospital and the medical campus for a variety of reasons. I think we should have that conversation on the phase 2 when it comes to council, because I think there's room for conversation there.
Kim, in your opening comments, you spoke specifically about some of those partnerships with other healthcare facilities and healthcare providers. I'd like to pivot back around to that. Can you talk about that? Because there's no question that a new healthcare village will have an effect on existing healthcare providers and facilities in Flagstaff. And from either a positive or negative position, I would like for you to speak to that, please.
Yeah, thanks, Pastor Kennedy. Yeah, the partnerships are the things that we, and I'll speak from, obviously from the world of COVID, we had congenial partnerships, right, amongst public health. And when we encountered a pandemic, it forced us all into intimately getting to know one another in those partnerships. And that included, Flagstaff Medical Center, NAH, that included North Country Healthcare, that included our Page Banner Hospital, our Tuba City Regional Hospital, entities all around the entire state, and ultimately, our surrounding states. And those were those opportunities to recognize the weaknesses of our public health system, to acknowledge them, although we couldn't necessarily fix them in the moment because we had a pandemic that we were trying to address. People were dying and things were happening, but it presented a platform and an opportunity for us to continue to use those partnerships to get at solutions that are going to enhance our entire public health system. And those conversations continue to this day. Have they backed off a little bit? Yes, because obviously in the moment we have more robust, urgency around certain things. I think there's a lot of opportunity around that. And as we look at, and this has been mentioned as well, certainly there is the need to bring in more rural healthcare providers across all of northern Arizona. We have a significant shortage of that, especially out in those most rural communities. And being able to have that continuum of care has to be, a hospital is a key component of that continuum of care, and having those partnerships to make those things happen and put those relationships and services in place together.
Thank you very much for that. And just real quick, what responsibility, should, Flagstaff residents who are going to get to vote yes or no on this proposition, what responsibility should we take in, making sure that the communities outside of Flagstaff, the county communities, are also well served? Kim?
I would echo some of the comments that Daryl made with respect to us being cognizant of our families and our communities. And I think that's one of the things that, as voters in the city of Flagstaff, I happen to be one of those. I've lived in Flagstaff for over 34 years, and I intend to make my decisions based on not just what I think I want for me in the city of Flagstaff, because I think that oftentimes looks very different to many of us who have lived here for a long time, and for many of those of you who have lived here for a short time. So my plea to everyone is that you recognize that you are not making decisions in a vacuum or in a biased kind of way because of the things that you're concerned might impact your own living situation or condition in a way that may actually benefit someone else. So I ask people to consider those things in any decision that they're making, and certainly in the future conversations that we all acknowledge we need to have.
Yeah, thank you very much. And just a quick reminder, I know we have gone just past 3 p.m. We are going to extend another, 27, 28 minutes and go to about 3:30. So please stay with us for that. And then a recording of this conversation will be available afterwards. I want to shift gears, because one of the other comments that comes up, and I want to read it this way: the question of whether hospitals should be in the business of real estate is complex and multifaceted. And I know the answer depends on the circumstances and perspective. So I want to talk about that. Hospitals generate revenue through real estate investments. And I know the concern here is, if healthcare is in the business of real estate development and not providing quality, equitable healthcare, then is their focus now on the wrong thing? And how does that adversely affect our community? Or does it adversely affect our community? Al?
Thanks. I'm not sure exactly how to approach this. I think that if you look at what is proposed in phase 2, that part of that development, regardless of, I guess my answer would be to separate the two things out, develop a state-of-the-art hospital where it is, and then look at your real estate, because frankly, you've already bought the property, you have it there. Whether it gets rezoned for all of the things you want to try to do, you're still going to reap there's no such thing as a bad investment in real estate. To divide your attention amongst the two things, my guess is you can hire managers to do that kind of real estate development. But what I see in phase 2 is nothing that's going to be any different than what we've had already, and it doesn't address basic community needs. There's no affordability out there. The jobs that are created after construction is done and goes away, the hospital jobs will be wherever the hospital is, but hotel, restaurant, and retail, do we already have those? And can we fill them all now? And also the question comes up is, where do these people live? Affordable housing is a huge element in all of this, and nothing proposed out there fits that bill. And so, you know, to further the conversation, if the design of things were different, and maybe the two were separated out, I could find something to support. But as it is now, I just think it's urban sprawl, and that phase 2 is not going to be walkable. It's not going to be compact development. It's not going to be in line with the tenets of the regional plan, as I understand those tenets over the years.
And just to re-emphasize, Proposition 480 is only about phase 1 of the development plan. So I think that's important to make sure that everyone in the audience understands that. Gail, I'll get to you in just a moment. Daryl, you had your hand up first.
Thank you, Pastor. So when it comes to the commercial development part, you know, I'm still learning and also asking questions about this, just like many of the folks listening to this. And so what I can tell you is that first, when I was doing work running healthcare organizations, I was doing recruitment. Outside of the job itself, when you would talk to primary care providers, for example, they typically had 3 questions that they would ask about the community outside. One is, how's the housing? 2 is, how's the school? And then lately it became, you know, are there opportunities for my spouse to work in the community? And so when we look at these kinds of developments, one is the community, I believe, is comfortable with commercial development inside healthcare organizations. It's not uncommon if you go down to Phoenix that there's a food, you know, court inside of a hospital now. You see other kinds of services. And so is there opportunities, extensions outside of healthcare organizations to create these types of amenities? I'm not sure right now, but there are examples in Minnesota. There's examples in Michigan about how they've done well in integrating these real estate or business developments with healthcare organizations. So that said, I believe, and I talked to some of the executive leadership about why we were looking at this. Again, this predates my time on the board, but really they were looking at, you know, if they can provide in this other phase 2, again, not talking about this, the hospital, but when I talk about the other part, the phase 2, it was about how do we develop maybe some affordable housing or housing options for staff and so on. Again, that was one of the thoughts. The other one was, is it possible to have conversations on what are healthy food choices, what are healthy food opportunities that you might be able to create? And then lastly, healthcare is a tough business. It has small margins. And so is there opportunity to generate revenue that can help support healthcare services to provide more access to care? And so those are the conversations that are going on. And those are things that we can talk more of when we get to that second rezoning conversation.
Great, thank you. Gail?
Daryl covered a lot of the comments that I had, but I did want to back up to something that Al said about not addressing basic needs. Flagstaff has declared a housing crisis. I see it all the time in economic development, is where are people going to live? Where is our workforce going to live? And I know that this is the second phase, and Prop 480 is only about the ambulatory portion of that. But the question was about, should the hospital be in real estate development? And in a hotel and a restaurant, like Daryl mentioned, those are, you know, services that go along well with the hospital. But I think that the homes is really important, because there is a need for that workforce housing within not just Flagstaff, but in our greater region. We are short over 17,000 housing units within the region, which is a big deal. And in terms of new jobs, it absolutely brings new jobs. there is a proposed bio and research park on the full acreage. Now, keep in mind, full build out of this isn't expected until 2040. That's over almost 20 years away. So I do think it's going to be good. And it's not just for this particular area. Let's talk a little bit about the infrastructure. There's been some projects that have come in the past. I'll talk about the Villaggio project. You know, there was need for additional infrastructure, sewer lines, water lines, all of those things. Those are things that the developer is being required to pay for. They are paying for the expansion of that road. And I think that's going to help. There's also the city of Flagstaff has a 32-acre bio research park just across from the Swift gas station. So that area, you know, as I mentioned in my comments, 2015 APS put a substation in. It's been on the radar, and now it's starting to move forward. So I just wanted to add that there are jobs coming that are outside of just the ambulatory piece.
You did mention that with those jobs, you know, schools, housing will increase and whenever there's an economic development, we can expect that is part of the byproduct. I want to throw this out now. I'm going to get to you in just a second. I know you want to weigh in on this, but I want to put this out there because it also seems to be maybe a little bit of the underwriting sentiment when we talk with more of the people who are opposed to Proposition 480. Is it a statement about current hospital leadership? You know, is that one of the components that's maybe driving some of the negative sentiment about a new healthcare village? And if any of you want to weigh in on that, I would love to hear it. Al?
I don't want to weigh in on that one. That part of it, yeah, I think I'm glad to see Mike's hand is up. What I want to weigh in on is some of the what I think are poor perceptions of exactly how growth and what kind of growth is good for the community. Gail, your latest study has indicated a gap of 17,000 units needed for affordable housing. The city of Flagstaff's plan had 7,900, and their plan called for the creation of 254 units in the next 10 years. None of these things are going to solve the problem. And I don't see doing the kind of development that we're talking about. Let me go back really quickly too, and disagree in principle with a couple of the statements that say that this is only about phase one. Yes, the vote will be to rescind the rezoning that was approved by the city council for the hospital to build or to move. But phase one and phase two are inextricably linked, and you can't talk about one without the other. Because why are they included? Why is the development agreement on phase one talk about 315 houses? The fact of the matter is that this development is a massive expansion to the west of the kind of development that maybe won't meet those community goals of A, carbon neutrality, and B, affordable housing and compact development and infill and so forth and so on. So, and let me also just add really quick, when and if, whatever the outcome of the vote, I think at this point in time to certainly get more folks involved in the planning and the thoughts about what does evolve out there. It's an opportunity that NIH, I think, missed in the first case. They talked to the people that they needed to get the rezoning done, but the reaction and the pulling of signatures and putting it on the ballot should indicate that maybe they needed to have talked to far more people. Thank you.
Martinell.
Yeah, you know, the issues around this topic of 480 are significant. There's lots of dimensions that we haven't gotten into today. You asked the question about, is this some kind of a statement about the leadership at NIH? You know, Flagstaff is a small town, and things go through this town at significant wildfire pace when things are happening. And issues that happen up at the hospital are a lightning rod, and they go through this town like unbelievable rates. I remember times I was hearing things in the city from folks I know before we heard about them in board meetings. And so all that kind of backtracks into the leadership and who's in leadership and who's responsible for things like employee engagement and provider engagement, you know, things that actually matter in providing healthcare to people in Flagstaff as well as the whole region. So I think in some people's minds, yeah, that this is a referendum that talks about the leadership team out at NIH. But there are some people that are equally as set that, you know, there are environmental issues that have to be addressed that haven't been addressed, or there are financial issues that need to be addressed, and we haven't heard from NIH on those issues. So there's many facets. I think what you touched on relative to management and leadership at NIH is one of those, but only one of very many things that people have an issue with.
Thank you. On that subject of effect on the environment, do either of you have concerns about the project's environmental impact or its potential effects on the local ecosystem?
I don't know that I'm the person. I don't know that I'm the person to speak to this. I think there are probably far more environmental experts out there that can talk about it. I think that a development of this size on the western side of town is going to have some impacts in some ways. That the hospital, and Gail mentioned this before about developers paying for the upfront infrastructure, and to me that is a cost of doing business. Once that is recouped, then the burden falls on the taxpayer. And the taxpayers, they're going to build Beulah, but they're not going to plow it. They're not going to patch the potholes. They're not going to sand it in the winter. They're not going to water the median, and they're not going to patrol it in police cars. Much of the infrastructure that is needed to accommodate a development of this size is going to have to be provided by the city. It's in the staff report that the contributions will be significant, and they'll be covered by the city. So the environmental impacts, there'll be more impervious surface, more stormwater runoff. You better make sure that you've got that. I was on the bond committee. I saw a lot of things that we had to bond for because regular taxes and fees don't cover the extent of the services that are necessary. And I think that's a huge impact, whether it's environmental or not. It's an impact on the growth of your community and what does your community want to see in terms of that growth, and how do we get those benefits, the 17,000 units, how do we make those up? There are ideas out there. I would love to be part of the conversation afterwards. Thank you.
Well, and acknowledging, there's not really environmental experts on this panel, so I appreciate you weighing in with that opinion. I want to keep the answer on that one short because there are a couple of other things that I want to get to, and we are closing in on the last 10 minutes of the conversation. So if we can be quick on these, Daryl, I'll start with you.
Just really quickly then, I was looking at some of the reports that were just available, I think, recently. And one of them did state that, with the new development, they're estimating that you'll have about 27 million gallons of water saved in the new facility over the current existing facility. And so I do know that current building codes and other design requirements do make new construction a little bit less harsh on the environment. It's a little bit more in terms of sustainability elements can be designed in and are included in where we're at now. So that's sort of the advantage of the new facility over the old.
Okay, thank you for that. Gail, I wanted to ask this, and if anyone else wants to weigh in on this, regarding the current location, do you feel confident that vacating the current location will not adversely affect potential economic growth in the city? And then I want to, while you're on that, because I had another one, with all of this being said now, is there potentially a better action plan than the one that's on the table for the city?
Oh, yeah.
That's a lot to unpack, Pastor Kennedy. Thank you. Let's start with that particular location. As an advocate for regional economic development and how it benefits our entire region, it does make sense. You are in an area that is right off the freeway. It gives access. We need to keep in mind who they're currently serving. And I believe it's something over 50% is outside of the region. Again, I keep going back to the visitors. They're a big part of our economy here in Northern Arizona. I know this hospital is for Flagstaff, it's for our residents, it's for our region, it's for our visitors. And I feel like in that location, it would have easier access, right? So I want to add that. I also want to mention on the environmental piece, I think that the cost of going to Phoenix back and forth to get the healthcare that you need is going to have a huge impact on our environment if that's our only option. I also feel that, NIH has made a commitment via the Biden administration to reduce their carbon emissions by 50% by 2030, and I believe it's carbon neutral by 2050. So I think that carbon neutrality is a process. It's not something that happens overnight. And you had one more question in there. What was the other question, Pastor Kennedy? I'm sorry.
And thank you for that. The kind of did jumble a couple questions together, but is this the best action plan for the city? But
I don't want to speak on behalf of the city because I no longer work for them, but I believe that parcel right now is currently zoned for 1 acre home lots. So when you look at the overall development for that area, looking at the jobs that it would bring to the region, looking at a potential, the second phase, which I do believe was required by the city in terms of the development agreement, a hotel for the airport, which is so prosperous, looking to get new airliners. That area is going to increase in business. So, and quite honestly, healthcare is, like I mentioned when I opened, is a primary sector for us. It's high-paying jobs with NAU and CCC providing the healthcare workers that's needed for our region. They're already here. Now they're going to have a place to go right away. I think that's really key. So I do think that that's it's a good project for that area. Yes.
Very good. All right, we've only got a few minutes left, and so I want to give each of you an opportunity to have some closing comments. I'd like for you to, within the context of the closing comments, I would like for you to address just what has been the inability to have a civic discourse like the one that we've just spent the last 90 minutes having. I think that our goal here was to demonstrate that these difficult conversations could take place without us insulting one another or disregarding the opinions or the positions of others on the panel. Hopefully, prayerfully, we've done a good job in setting an example for future conversations like this. I'm going to go in reverse order. Your final comments, you've got about a minute and a half on this, and I would also like for you to address the topic of the importance of respectful, constructive, civil engagement going forward. Al, I'll start with you.
Thanks. And I got to say that all of the people who've been involved in this conversation today, if I don't consider you a friend, I consider you a colleague, I consider you an acquaintance, and I consider you a very valuable opinion in the discussion. I think that the civility, frankly, it comes from the top down, and we've seen national politics just go to the extent of an assault on the Capitol. I mean, the fact of the matter is that when you present facts that may not be facts, you create suspicion. When you create suspicion, you create distrust. And when you have distrust, you have a hard time talking to each other in a civil fashion. I think that Flagstaff is far from that, and that our ability to talk civilly to each other and disagree vehemently is really a reason to continue the conversation and to expand the conversations, because you want more and more. The more opinions, just like the more votes, you get a better representation of what your community is actually thinking. But on the subject of voting, why do we vote? We vote when we can't reach consensus, and we have to acknowledge the fact that you accept the results of that vote and peacefully transition to the next phase. Thank you.
Thank you. Kim?
Thank you. I echo many of Al's words with respect to appreciating the conversation and all of you and the comments and perspectives that you bring to the conversation. I think, one of the things that, as Al had mentioned, that make it very difficult from having discussing controversial issues with civility is definitely, representative of all the things going on around us, not only in our nation, but in the world. And so I think that the opportunity, and I'd said it initially when I was speaking early on, hard things are hard. And we have to take the time to reach out and talk to people, to bring them along. Now, we have to be realistic about that, because we can't just talk it to death and never get to decisions, but there's a balance there. And it is about having those conversations, respectfully disagreeing, allowing for time for people to bring information forward to answer questions. So I think that there's the opportunity to continue conversations, and absolutely, as we go forward with other issues, to think about that before they become issues, so that we don't get to the point of where we need to be having these conversations where people are pointing fingers and it is as heated as it often becomes. So thank you.
Thank you, Kim. Daryl, Melvin?
So I appreciate being here today, and thank you for everyone for staying with us the full length here. So just in closing, I would say that when it comes to the proposition, I would ask folks in consideration of being a good relative to vote yes on Proposition 480. And in Hopi, again, we say Samit Nangwa. And it's about coming together in an action that benefits others. And it's a way to return something of value to our community. And so that's what your civic engagement is doing by going out and voting. And so to address the question of just civil discussions, I would just say that years ago, I should say, I was driving with my son who was in the 5th grade at the time. And we had this conversation, and for some reason the subject came up, but what's the difference between winning and being successful? And without missing a beat, he said, to win means that somebody has to lose, and to be successful means both can win. And so having conversations around new ideas and perspectives, and then adding the aim goal of maybe having conversations such that you can have future conversations with the same group, but maybe about different ideas or different thoughts. That's what I believe is how we can have successful conversations discussing controversial topics. So thank you.
Thank you. Very well said. Mike Martinell?
I agree with what Al said, that there is an attitude in this country that seems to endorse having civil discourse with folks. I think as it applies to what's going on here in Flagstaff and specifically on Proposition 480, I think the hospital itself, when that topic comes up in the city, is a lightning rod. It will engender discussions broadly across the organization. Healthcare is a very personal thing. This affects every one of us, and we all have opinions about what's going on in healthcare and stories about what our last doctor visit was like, and if we were able to have and get out of that meeting what we were looking for. So I think you pile those things kind of together with the attitude in the country, and I think there's a dimension of this that I saw that actually surprised me. I'm not huge on social media, but I think social media in and of itself provides a tool. It's a tool that people can say whatever they want, misbehave online with no consequence, with no interaction back. And so because of that, that innate object between you and the person that you're discussing, a lot of things are said, and I think they would probably not be said if the discussion was in person. So I think social media has at least contributed in some way to this discord that we see about this particular project.
Okay, thank you very much, Mike. And Gail, we'll finish with you.
Mike, I agree with you on that social media is causing us all to be more polarized, and it's not good for anyone. So I've really enjoyed being a part of this panel today, and I'm hoping that all of us can have further discussions as the ballots are mailed out today. So I just wanted to leave you with a little perspective that 50 years ago, roughly 50 years ago, when the hospital was built, the population was around 44,000. It's doubled. And now, right, in 2023, the population just in Flagstaff has doubled. And I would encourage you to think, has the infrastructure doubled? Has the infrastructure doubled in order for us to get to the hospital? And I know that that's kind of a loaded question, but I want you to think about all of these things together. This private parcel, this privately owned parcel is being proposed for development. There was 300 acres on McMillan Mesa. Some of us might remember that was taken off the books for open space. That was for jobs. And so jobs are needed here. And I feel very passionately that more jobs makes our community stronger. And so as you contemplate all of the information that you heard today, I'm going to encourage you to vote. I hope you take this information. I hope that if you have further questions, I would encourage you to reach out to any of us. I would encourage you to reach out to hospital administrators, whoever you think you need to reach out to get the answers that you need is incredibly important. But the most important thing is to vote. So thank you.
Thank you. And I want to thank each and every one of you for your time this afternoon and for being willing to have this hard conversation. Kim, I love the way you put that. Hard things are hard, and they require that we come to the table and we have dialogue like this one, and that we have a mutual respect and regard, even in those areas where we disagree. We have to be able to talk about those things so that we don't just operate and continue to engage each other in ignorance. During the course of this conversation, I think we all became more intimately aware of not just where a person stands, but why they stand there. What we do is important. Why we do it is more important. How we engage and our background, the conditions that drive our thinking and then the emotions that are attached to our decisions. It's important that we peel back the layers so that we can have this honest dialogue and walk away from it with not only a better understanding of the topic, but probably more importantly, a better understanding of one another. So thank you very much for that. It was an honor and a privilege to be a part of it. I hope that we have done something good here today, and that those who stayed with us, who tuned in, they recognize that no longer will we buy in to the concept that we can't talk about things. We have to, and we have to be able to do so constructively and respectfully. So thank you for that. David?
Thank you, Pastor Kennedy. Well, that was, we got to wrap up, but that was really pretty awesome. I think we heard a lot of facets that haven't been discussed before, or at least in a forum like this. I really want to thank again our speakers for their time and efforts to make this a great civil and constructive discussion. You all are thoughtful, well-spoken leaders. We're really grateful for your participation. We may not have changed anyone's minds, or maybe we have, but I'm certain we all learned something that we can take with us as we fill out our ballots to make a choice for Flagstaff's future, a future that is, it's important to all of us, all of our communities in our region. So again, thank you to everybody. And to close us out, I'll turn it back to Dr. Evans.
Well, once again, I just want to echo with the thank yous. And I also want to just talk a little bit about civility. Civility really starts with us. You know, we talk a lot about what's happening in social media and what's happening in different levels of government, but we all have the ability to govern ourselves. And I think we saw that today play out very nicely with this robust conversation with different viewpoints regarding this particular issue. After the election in November, we are going to all be Flagstonians, or we're going to be residents of Coconino County. And we're going to have a lot of other issues that we still need to address: water, housing, climate, small businesses, and workforce. Numerous challenges that we're going to have to come together to work on. Collectively, we are all stewards of this beautiful community, and we need to be able to talk and have conversations if we are going to be able to move forward as a collective. So thank you very much. I look forward to seeing you all out in their community.
Thank you, everybody. Have a good day.